Hello and welcome to Rathods IAS. Today in this session, we are going to see current affairs of 4th June 2024. So let's get started with our discussion. And one thing I want to say, so because of election declaration day, so most of the articles, they are political articles. So don't worry about those and please don't read that article. So they will fetch you nothing. Okay, so don't waste your time. So only the articles which are relevant from our examination point of view, we are going to discuss that. So focus only on those articles. Okay, so today is our poll result day. So tell me, what are your expectations? So who will be our next PM? So give me your expectations that who will going to become our next PM in the comment box. Don't forget. Okay, so that's it. And now let us see this front page. So in this front page, there is nothing much important. You can simply skip this front page of our today's Hindu newspaper. Clear? And if you move on to the city page, so here also most of the articles are political articles. But here you can see one small article. Here and there we can connect with our syllabus. That is Anganwadi shut till June 30 as heat wave prevails in the city. So it is talking about Anganwadis, they are going to be shut. So actually in the summer season we have summer holidays, right? So here this shut of this Anganwadis is till June 30. It is because of heat wave. So already we discussed this topic of heat wave number of times, right? And apart from that, I want to say one thing, students. So here free of that is online live is going to be ended by tomorrow, I think. So tomorrow is the last day. You are going to get this live foundation course on YouTube. Students, if you are interested to take this full course and if you find that this course is useful and what are the tests we are giving, what are the main answer writing practice we are doing. So if you like this and if you want to continue this, so we are providing an offer for you students, especially who are serious aspirants like you. Okay, so we are giving this entire course of GS Prelims cum Mains Foundation, which is 30,000 rupees only. So here you will be getting classes every day. So how many hours? 4 to 6 hours of classes every day, and there will be personalized mentorship with toppers. And next one is daily answer writing practice that we started. So I want to say one thing, no institute which will be providing this answer writing practice from the day one, but we are providing that daily answer writing practice. And this one is we are also giving you daily prelims questions also. Yes or no? I will be sharing the links in the groups. And next one is we are going to have comprehensive classes for this CSAT and exclusive focus on current affairs. So I will be sharing you the monthly current affairs of May today, okay. So today I will be sharing you the monthly current affairs, and this much early no institute is providing that, but we are doing that. And next one is there will be interactive sessions and prelims and mains study material will be given, and apart from that you are also going to get prelims and mains test series also. So for all these things just we are charging 30,000 rupees. Okay, so if you want to clear this UPSC examination, so all these are must. Okay, so try to take this course. It is very advantageous and it will be very much helpful to clear your UPSC CSC examination for sure. And next one is we are also providing offline classroom program. So the same facilities will be provided, but you will be coming to this classroom and you will be sitting in the classroom and listening the classes, right? So for this the cost is 75,000 rupees only, and this course it is for 9 to 11 months of duration, and before prelims you will be having exclusively prelims based classes for sure. And if you want to take admission either on online or offline, and if you have any queries, if you want to talk to me directly, you can call me on this number 8074765513. Clear? Yes. And now let us see our first topic. It is our heat waves. So number of times we discussed this topic, right? Heat waves. So this article is important from your GS paper 1 under geography. Under geography, this article is very important. So here you have to understand what is this heat wave and what is the criteria. So in this criteria you have to see what is the temperature should be crossed to say that is heat wave in plains and also in hilly regions, and especially you have to focus on impact of this heat waves. So I will tell you in which areas you can see the impact. First one is especially on agriculture production. So agriculture production will be impacted by this heat waves. And next one is it will be having impact on health. It will be having impact on overall economy. It will be having impact on environment and ecology, that is especially on biodiversity it will be having impact, right. And here you have to see map. So if you are following newspaper, you will be seeing map with red color, dark brown color, right. So there are some spots will be red color, some spots will be dark color, so which is showing about temperature or intensity. So here your work is to know in which areas in India we have very high temperature. Clear? That is the thing you have to know. So all these are very important from GS paper 1, and impacts you can see different subjects here, like from society, from agriculture production, that is again geography, next one is economy, health, environment and ecology. So here you can connect with different subjects. Clear? Already we discussed this topic number of times, and even you can see about definition which is given by IMD, World Meteorological Department. Okay, so even there is a chance of getting questions from facts of this IMD, WMD, like that. And that is the first important article, and number of times we have discussion regarding this heat wave. So it is your work to revise that topic. Okay, now let us move on to state speech. So even in this state speech I found nothing much important. Directly we will jump on to this editorial page. See, entire paper is filled with advertisements only. Okay, now let us see this editorial page. So in this editorial page normally we will be having 4 articles. Out of that only one article is very important in today's newspaper. Okay, that is about healthcare cost. So if you have opened your syllabus, in your GS paper 2 we have this topic of health. So anything that is related to health, if there is any article in newspaper, that will be very important. Clear? Here you have to know some dimensions. So I will let you know the dimensions first. So first of all, it is talking about health care. So there is one proverb, I think many of you might be knowing that health is wealth. So if you are having the good health, then that is your wealth. So actually this health is very important for any country to make it developed. That means for development of anything or any country, for example, we need to focus on 2 important areas. So one will be education and next one will be health. So in these 2 areas we have to focus for the development. So because of this, health becomes a very important component, and in any country Department of Health or Health Ministry will plays a very crucial role, because what are the decisions, what are the policies, what are the acts that are coming up, they will be having impact on entire country. Clear? Okay, now let us see here what is the dimensions, or what are the dimensions of what is the purpose of reading this healthcare. So first you have to see different stages or different types of healthcare in India. So how many types? So here we have primary, we have secondary and we have tertiary. Clear? Here you have to see what are the problems in our healthcare sector in India? Yes, there are lots of problems that we are facing. So one such a problem here is increasing of OOP. I am not talking about Office of Profit, which comes under polity. I am talking about OOE, that is out of pocket expenditure. Okay, out of pocket expenditure, OOP, out of pocket expenditure. It is not Office of Profit. So one such a problem here is there is increasing of out of pocket expenditure in this healthcare. And apart from that, from economy point of view, you have to see how much percentage of our GDP that we are spending for our healthcare. So this is one important thing, and you have to see like what are the measures can be taken. So in problems, I want to explain you one problem here is there is patient to doctor ratio. Patient to doctor ratio is very high. Okay, it is, we are not following the standards, and as well as nurses are also very less in India. Okay, and even what happened, especially we are focusing on the treatment part, but in India we are not focusing on palliative care or prevention or preventive care. So before getting disease itself, we have to take some measures or preventive care so that we will not get that disease, right? So always everyone, our elders, they will be saying that prevention is better than cure. Okay, we have to prevent the disease to enter into our body. Okay, rather than if you are fighting after that so and so disease occurred, means it is not the good thing, because it will be having negative impact on health, on economy, everything. If you are getting one deadly disease, then you will be getting into death trap for sure, right? And even here you have to know about rare diseases, because this rare diseases is highly in use, medicines for these rare diseases. So there is a high chance of getting these rare diseases in your examination. Clear? So actually this article, it is talking about healthcare expenditure, that is especially out of profit expenditure. So we are going to see that in detail. And what are the details now we are going to discuss? So those points that you can directly write in your examination. Clear? So this topic is at most important from your mains, not from your prelims. So now let us see this topic in detail. So we are talking about healthcare cost. So nowadays, because of increasing of health disparities and uneven access to medical services, that means if you are comparing rural areas with urban areas, who is having the more accessibility for this health services? It's obviously urban people. Rural people, they will be not having that much amenities. So in rural areas we have these primary healthcare systems, but they are not much equipped and they do not have much infrastructure. Clear? So here we need equitable and sustainable healthcare policies. So because of this, this article is in news. So I want to show you like how the Indian healthcare system was there. So here we have government sector and we have private sector, but private is flourishing nowadays, right? So if you are talking about this public sector, so we have Ministry of Health and Ministry of Defence and Ministry of Railways. So under this we have healthcare system. So normally in the Ministry of Health we have at central level and at the state level. So here we have rural areas and urban areas. So in rural areas, which kind of healthcare centers we have? So we have community health centers, PHCs, that is primary healthcare centers, sub-centers and ASHA, ASHA workers. So these are the rural areas. They are under state, and on another hand we have urban, right? So in this urban we have super specialty or referral hospitals, special disease hospitals, district hospitals, government medical colleges and taluk hospitals. So these are from urban areas under state. So in central level we have employee state insurance dispensaries and hospitals, and we have central government health schemes, medical colleges and national health institutions, Ayurveda, Yoga, Naturopathy, Siddha, Unani, Homeopathy. So all these will come under this center. And under this Ministry of Defense, okay, we have some special army related things like army hospitals, there is specialty hospitals, army medical colleges, base hospital and dispensaries. And apart from this Ministry of Defense, we have Ministry of Railways also. So here we have dispensaries and hospitals under this Ministry of Railways. So this is from our government side or public side. So from private side, we have again two types, one for profit and one for non-profit. So let us see for profit. So in profit, we have normally private clinics, so nearby in the corner of your gullies, okay, or like streets, we have these small clinics. Okay, so they are by RMPs, registered medical practitioners, right. So first one is we have private clinics, and next one is mostly in every area you can say private nursing homes. They will be dealing with delivery or pregnancy or obstetricians, right. And next one is we have specialty hospitals, and in some areas we have big multi-specialty hospitals like Apollo, okay, like Apollo, everyone knows about this Apollo hospitals, right. Okay, Apollo, Yashoda, Virinchi, like that, and KIMS, that is Krishna Institute of Medical Sciences, so where I did my internship. So those are like multi-speciality hospitals. And next one is we have the another thing that is non-profit private hospitals, like we have charitable trust. Okay, we have charitable trust or hospitals, and next one is we have NGO run clinic, etc. from hospitals. So this is about the healthcare system in India. So I covered both public and as well as private. So I also covered about the subsections. So now let us see what are the various reasons. Now there is increasing of healthcare cost in India. You have to know what are the reasons for this increasing of healthcare cost. So first and the foremost thing here is because of unregulation and profit oriented healthcare sector in India. At present, what is happening is in private sector, okay, in private sector there is blooming of private sector in this healthcare services. Normally these private sector, they are profit motive, right. So they want to get maximum profits. So this is one important thing. So because of this there is increasing of healthcare services. And next one is high out of pocket expenditure. So even though, for example, if I am going to any government hospital, so if that government hospital is not having the adequate amenities, infrastructure, then they will ask to go to private and to get that test or that thing to be done. So here I have to use my money from my pocket or from my purse and I have to give to them, correct. So in this way here out of pocket expenditure is increasing in India, and if you are comparing with China, so here in India out of pocket expenditure is 60 times more compared to that of China. And next one is weak implementation of laws. So whatever the laws which are came up by the government, okay, whatever the laws which are came up by the government, so they are not properly implemented. So because of this there is no change in the service delivery system. And this one is issues in capping medical devices. There are many medical devices that we will be using, for example hearing aids, for example chips, okay, that is used in this joints, okay, like that we will be using many medical devices. So design and implementation capacity constraints, they are seen in India, and because of this we need to import them, or for example implants. So because of this what happened, there will be increasing of prices of this medical devices. And this one is now we are going towards corporatization of healthcare. So the nature of tertiary care in India, which had been changed drastically in last 3 decades, and because of this it is often critiqued as corporatization of healthcare, and large tertiary healthcare providers in India, they are belonging to this charitable trust or foundations, okay. So they mainly prioritized of care over this profits, unlike the present times. And next one is inadequate investments in hospital. So even though if you are seeing like a central government or state government is funding towards health, but whatever the funding they are doing, so it is very less. So this is one important issue. And next one is, how can we prevent this rise of healthcare costs in India? Because we have to control that. So you are going to be the civil servants, right? So one area that you have to focus is health. So if I want to share one of my personal experience, I saw one family. Okay, so in that family, so the main head of family got some so and so disease. So here, to cure that disease, they need to go for surgery, but they do not have that much enough money. So finally, what happened, that family went to borrow money from money lenders, and finally they got that surgery to be done, and it was successful. So after that, here they can't pay the hefty interest on that so and so loan. So finally they went into debt trap, and they sold the small land they used to have. So they sold them, and they finally repaid. So if there is any disease or anything which is mainly seen in that family, especially health related issues, then that family will go into debt trap for sure. So because of this, government need to be take care of providing insurance or providing proper services which are free of cost for this kind of people at least. Okay, so first and the foremost thing here is, we can formulate standard treatment guidelines, that is STG. So we have to formulate standard treatment guidelines. So as per observations of Supreme Court, pricing related discussions must start with a benchmark for price determination, and a standard treatment guidelines, they can help to establish relevant clinical needs, the nature and extent of care, and the cost of total inputs. So all these need to be regularized. So here government need to be take care of all those things. And next one is, there is a need of comprehensive health financing reform strategy. So here we have to go for standardization, and we have to go for capping. Capping means we have to keep the limit for the procedures. So for example, there is one test called as NIPT, non-invasive prenatal test, okay, antenatal or prenatal test. So in that test, that will be used to diagnose fetus genetic conditions, okay. So if you go to one center to another center, the price will ranges. So from 14,000 to 25,000 they are charging. So if they are fixing a price cap that for NIPT they have to take around 20,000 or like 50,000, so everyone will be having that price, right. So here there is a need of capping of prices of these procedures, so that we can decrease this health care cost. And next one is, following the models of Tamil Nadu and Rajasthan. So to finance medicines and regarding the supply chain stakeholders, so especially states like Tamil Nadu and Rajasthan, they procure cheap unbranded generics from manufacturers via centralized agencies, and they will sell directly to the patients. So if you are prescribing the branded drugs, the cost will be increased. So for that you have to prescribe generic drugs. That thing I learned in my internship, okay. And next one is, maintaining transparency and standardization of rates. So private healthcare providers, they are perhaps unique among the commercial services in India, okay. So here we have to focus on, yes, transparency should be maintained, it is utmost and it is very essential. And this one is, we can control commercialization of colleges. So actually in medical colleges, if you want to get the seat in medical college, so how much amount you should pay, any idea? So actually I want to say my own tragedy. So because of lack of money, I left A category seat, and finally I joined PharmD, Doctor of Pharmacy, because of money, okay, because they will ask hefty amount of money, okay. So for the poor people it will be like a dream that used to be faced by me personally. Okay, so here we have to control the fees of colleges, and the fees of a private medical college should be par with this government medical colleges, so that here we can reduce this healthcare cost. Because now for example I am paying 20 lakhs of rupees to get a medical seat admission. After completing that, I will be charging on the people, right, who are coming to me, so that I have to repay my loan. So if I am getting that seat for 5 lakh rupees or as per this government standards, then I will be not charging that much fee, prescription fee on the people or else other diagnostic procedure fee. Clear? So for this it is very important. And next one is, what are the various government related initiatives related to healthcare? So related to healthcare, so what are the government related things are there? So first one is National Health Mission, next one is Ayushman Bharat, next one is Pradhan Mantri Jan Arogya Yojana, next one is National Medical Commission and PM National Dialysis Program, Janani Sishu Suraksha Karyakram, and next one is Rashtriya Bal Swasthata Karyakram and increased allocation for health in budget, and PM Atmanirbhar Swasth Bharat scheme and National Digital Health Mission, National Medical Commission Act and Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana. So these are some important programs, okay, which came up by government. They are related to healthcare. So whenever you are writing any essay or any answer regarding health, so try to incorporate at least 3 to 4 of these schemes in your answer, so that you can increase the value for your answer. Clear? And now let us move on to next topic in our op-ed page or opinion page. So this article is important, is about missing in manifestos children issues. So I want to ask one question. So have you gone through any manifesto of any political party like Congress party or BJP party or any party? So if you go through them, so they will be providing normally freebies, but nowhere they will be talking about children. Yes or no? Children's health, children's education. So actually these children, they become 30% of our population, but despite of this, here in election manifesto, so no way they did it about, or no way they addressed about the issues of these children. So children issues, it is very important. So here especially this article talked about 3 important things. So it is talking about children issues. And this topic is important from your GS paper 2 under polity and governance point of view. So in this children issues, you have to know about education and you have to know about nutrition, and third one is you have to focus on health. So these 3 things ought to be taken care of whenever you are talking about these children issues. Okay, so if you are getting any interview question regarding what is your mission regarding children, so try to answer these 3 things, like I want to focus on education, health and as well as nutrition of children, because today's children are tomorrow's citizens. If you want to build a good nation in future, you have to focus on children today. Clear? Yes. Now let us see this article in detail. Okay, so here children, they form about how much percent? Here you can see 30% of India's population, but they are invisibilized during elections. During elections they are not visible. And next one here is India has largest child population in the world, yet most political parties, they turn into a blind eye to see into this children's interest. So the first one is education. So actually one BJP party manifesto said that we are going to develop this network of PM Shri schools, Ekalavya schools and other such schools as per national education policy, that too at world class, and they want to strengthen few cost incentive model schools and they want to provide high quality education. But the thing which is missing here is they didn't consider any alternative to make any systemic changes to improve this public education or not. They didn't said about what strategy they will be following, so that is missing. And next one is BJP manifesto also speaks of working towards 100% GER, that is gross enrollment ratio, that is students, they will come and they will join the schools. Okay, that too from preschool to secondary level, but again they failed in stating which are the concrete steps they are going to take to achieve this objective. And next one is they also said that we are going to achieve 100% of GER from pre-primary to secondary school it is only possible that if you are providing free and compulsory education under this RTE Act of 2009, but it is also missing. And even regarding this nutrition and this healthcare, on nutrition, here now present BJP party which promised that eliminating malnutrition, especially in these tribal children, and also Congress promises that they are going to focus on nutritional deficiency among the children. But both these parties, they fail to indicate that what are the concrete measures you are going to take to address this issue, especially in light of Poshan Abhiyan. So how they are going to use this? But here we are also having one more scheme, that is ICDS, Integrated Child Development Services. So as it is a critical tool for countering of malnutrition among the children who are below the age of 5 years. And under this you are going to provide nutrition program, nutrition as well as health education and health checkups, etc. And if you are talking about why we need to focus on this malnourished children, so malnourished children, they are very much vulnerable to these preventable diseases. So they will be attacking by these preventable diseases. And even our National Family Health Survey, so this survey which had been conducted in 2022 reported that India is constantly battling with chronic malnutrition in India. Okay, so especially chronic malnutrition children is facing in India. And next one is India is also falling short of meeting this SDGs, that is Sustainable Development Goals. Okay, so this is also one important issue that is mainly said. And next one is in which areas you have to focus. So you have to focus on involving children in decision making policy or decision making process. Okay, and we have to prevent exploitation of children. And even political parties, they need to take or they need to make education, child nutrition and as well as health as their priority areas in their manifesto. Okay, so this is the thing which mainly said. And now let us move on to our newspaper. So here there is one important article, that is what's missing in this disaster database. So what is this database? Database is nothing but wherever we are storing the data, that is called as database. So which database it is talking about? It is talking about disaster database. So here you have to know some details and even you have to know why we are calling it as a missing information in this database. So this article is very important. So please let me know why we need this disaster database, and within meanwhile I will have some water. So my throat is drying up. So tell me fast. Students, come on. Okay, so as this database is saying that yes, what are the disasters now we are going on, so we are having a proper record. But what about the disasters that already happened earlier? There is no proper data. That is the thing which mainly said, and it gave some details and you have to know that. That is very important. So first of all, let us see why it is in news. So in 2023, Food and Agriculture Organization, that is FAO of United Nations, noted that disaster events across the world had been increased from 100 events per year in 1970s to now it is 400 events per year in last 20 years. So there is increasing of disaster related events. And next one is an analysis of disaster database, which shows that increase in the number of disasters is partly a result of reporting bias. So this is also saying that analysis of this database. So after once you analyze this database, it is saying that yes, obviously there is increasing of number of disasters which are going on. Clear? And the data collected from various disaster events, they are saying that what are the factors which are responsible? Come on, tell me, what are the factors which causes disasters? So, first one is because of climate change. First one is climate change and next one is there are also some lesser events where the fatalities are less. So, we have the events where the fatalities is high and where the event fatalities is low. And this article which is also saying that more recently reporting and communication of small events have been improved. And this one is in 2024 report, CRED noted that historical data was based on retrospective analysis and also resulting in a list that included mainly events of major importance. So, only if you go back to the date of this disaster, it says that only the major events have been recorded, but what about this minor events? No, there is no data. And this is because of there is no proper humanitarian assistance or because of no proper telecommunications, especially in particularly developed and few organizations. Only them they had been having some interest to compile this data. And even now also there is a trend of small events. They are very fewer than 200 deaths, increased greatly in 1980s and 1990s. So, in this way it suggests that small events are missing in earlier periods. Okay, small events are missing in earlier periods and have been reported more consistently only in the past 30 to 40 years. And even this article says that the data coverage is also tended to be the poor, okay, especially in the low income countries. So, there is high numbers of disaster. That is the thing which mainly said here. So, from 2000 to 2019, only 13% of disasters in Africa and 23% of disasters in South Asia, they are reported that they caused economic losses to those countries. And disaster statistics, what they say, the first important thing here is, so many regions like sub-Saharan Africa, they have poor data coverage, okay. And next one is, over half of the heat events, they were reported from only countries like Japan, India, Pakistan, US, France, Belgium, UK, Spain and Germany. So, in these areas we have this reporting of heat events. And next important point here is disasters, they have often near term, and because of these disasters obviously they will be having negative impact on property, life, okay, and as well as they will be having medium to long term impacts like malnutrition and even food insecurity. Okay, so these are some negative impacts. And now let us see the next topic. Okay, so this is about our opinion page. So today's text and context, it is about one party, we are not going to deal with that. And you can directly move on to your news page. Okay, so in this news page I found one article which is important, that is SC directs, that Supreme Court directs Centre to hold Yamuna board meeting to address Delhi water crisis. So this water crisis is a very important problem now we are facing. Okay, so let us see this topic of water crisis. So this article is talking about what? Water crisis. So this is important from your GS paper 1 under geography. It is important from your geography from GS paper 1. So you have to understand what is this water crisis. Okay. So what are the reasons for this? You have to see what are the reasons for this water crisis. And you have to see what are the causes for this water crisis. And in which areas in India we have this water crisis. For example, in almost all metropolitan cities we have this. And you have to see what are the measures can be taken. So, all these are very important areas that you have to focus. And if you move on, here you can see one very important article that is about forest fire rages in Himachal Pradesh expected to bring relief. So recently we studied about Uttarakhand forest fires, right? And Uttarakhand and Himachal Pradesh, they are present side by side. So now it is in Himachal Pradesh. So this Himachal Pradesh is Himalayan state, right? So now let us see this topic in detail. And this topic is important from your disaster management, which comes under GS paper 3 and even from GS paper 1 also. Okay, now let us see why it is in use. The first and the foremost thing here is a prolonged dry spell, usually very high temperature across Himachal Pradesh in past month. In the last month, yes, there is very high temperature and very dry spells. So because of this, wildfires have been arise and they destroyed forest cover. And even that is having negative impact on forest ecosystem and also on biodiversity. So if you see the details, it says that also called bush or vegetation fire or wildfire. So forest fire is also called as bush fire or wildfire or vegetation fire. So it can be described as uncontrolled and unprescribed combustion or burning of plants in the natural setting such as forests, grasslands, brushlands or tundra, which consumes the natural fuels, and even that will be helpful to spreading based on environmental conditions. And actually if you want this wildfire or forest fire to be existence, so we need some components, like we need heat source, we need proper oxygen, because without oxygen we can't support combustion, and this one is we need fuel. So all these three are very much required for this forest fire. So keep this in your mind. And now let us see what are the reasons for these forest fires. So first one is human carelessness. So whenever human beings are moving across this forest, if they are smoking, so they will be throwing that cigarette butt or pick there itself. So because of that, that will cause fires. Or like majority of these forest fires are caused by human activities. For example, discarded cigarettes, campfires, because of burning of debris or any other similar process. That is a one important reason for this causing of forest fires. And this one is with increasing urbanization and human presence. So because of this increasing of urbanization, human presence in the forest areas, so there is also increased risk of accidental fires. And also what happened, because of this poachers, illegal smugglers, so they also set fire either to divert the attention of forest officials or to eliminate the evidences of their crime. So in this way also, yes, they will be doing or they will be causing this forest fires. And next one is weather conditions. So whenever there is no proper rainfall, whenever there is very high temperature or intense heat, that will also cause this forest fires. And next one is high temperature, low humidity and calm winds. Okay. So because of this also we can see this forest fires. And as well as aridity, southern India has experienced above normal temperature, and normally we have like clear sky conditions and lack of rainfall, and because of this that will be increasing this aridity, okay, drying out of vegetation. So it is also very much susceptible for this ignition, and also that will be facilitating rapid spread of fires. Okay, so this is about this topic. And I hope you understand this topic, right? And now let us move on to other important articles from our newspaper. So here you can see ICMR seeks to provide oral formulation of hydroxyurea to treat the sickle cell disease. So this article is talking about sickle cell anemia. So what happened, normally RBCs are in this shape, disc shape, but they will be becoming this sickle cell shape. It is like a genetic disorder. So now here ICMR going to give you oral formulation of hydroxyurea to treat this sickle cell disease, and there is a high chance of getting question regarding this sickle cell anemia in your prelims. So you have to focus on that. Clear? So these are the very important articles that appeared in our today's Hindu newspaper. So I hope you enjoyed this class. If you really like this class, hit the like button, and please do share this class to your friends. And one more thing here is, please do join this online or offline GS foundation course for sure. So thank you so much for watching, guys, and we'll meet in the next class. So actually I'm not getting much time to record this video because in the morning from 9 onwards till 2 o'clock sir is taking the class. Okay, so that I'm not getting the morning time to do this Hindu analysis video. So whenever I'm getting the time, I will be posting it. Okay, that's all. So please do adjust with my timings. Thank you so much.